So we've been asked to prepare a quick talk on, what drew us to working in mental health research, the challenges for multidisciplinary working, and some top tips. So, what drew me to mental health research is that it's so pervasive in all of our lives, whether it's individual to ourselves or our loved ones, our colleagues, or just someone we meet in passing in our society and communities. Mental health and well-being is rooted in all aspects of our lives. And so my research interest, like many others, stemmed from my personal connections. I've got young kids, and I see them struggling with having, one best friend one day, and then the same best friend the next day is their worst friend. So the impacts of relationship skills. And my young nieces, as an educationalist, I always come from an educational stance. So my young nieces and nephews struggling with anxiety and stress for their key stage 2 or GCSE exams, but also on the other side of that, I see my elderly parents and other elderly family members struggling to keep up with such a fast-paced society, struggling to keep connected with these developing technologies, and obviously the current living crisis. So it's just everywhere. And for me, particularly, my interest and passion stem in supporting those with similar identity markers of, for example, coming from an ethnic minoritized group, or being Muslim in an ever-growing Islamophobic society. Unfortunately, the experiences of support for those from minoritized and disadvantaged backgrounds, looking at them in an intersectional way, is somewhat overlooked in mental health research, in educational research, and even less so through multidisciplinary lenses. So some of the challenges of working in a multidisciplinary working, and I agree with lots of everything that's been said so far. But for me personally speaking, I think there's a fear, or what's the word, uneasiness of the unknown. For example, myself, I don't know how the dentistry discipline operates, for example, or the epistemological positionings of those from geology, or the methodological approaches of computer engineering. I might, maybe you can tell us about a little bit more about that. But so we need to be a bit more open-minded, open to change, open to listening, and as Nicola mentioned earlier, about really embracing this uncomfortableness, and understanding and recognizing that other disciplines, fields, subjects have these really amazing skill sets and different ways of problem solving, and then these different perspectives can result in some really innovative and interesting work that can support the development of mental health research. And I just wanted to add, parallel to all that, I think another challenge, and Cam, you said it's a dirty word earlier, but this notion of power and this relinquishing of power. It's a big challenge, the power of our thoughts, our privileges, our practices. And it's very difficult to relinquish and compromise some of this power, even if it is for the greater good. So, a mixture of these challenges of, stepping out of our comfort zones, being more open-minded, and subsequently relinquishing our power. Some of my top tips, again, some really, really great top tips being presented here, so I'm not sure I can add anything much more novel, but if I were to give a tip to myself, first and foremost, as an early career researcher, I just tell myself that, all of these things are not going to happen overnight. And I think we need to make small yet continuous, baby steps towards change. Whether that's by engaging with something outside of our discipline and area. It could be simply things like attending online events, or listening to YouTube videos or podcasts, or even following someone different on social media. Really, really baby steps. And I don't mean it for us in this room. I know I'm preaching to the choir here tonight, but it needs to happen. And again, I know it's spoken about before, but from top down. So, our glorious leaders in the government to, the different yet very individual funding councils. And I know, Cam, you did a really great blog post for SMaRteN about funding councils and how they need to embrace multidisciplinary work. And even, senior leadership teams in universities and health services. So there needs to be a systematic restructure to develop a multi disciplinary approach. And I honestly believe that through these baby steps, they'll lead to bigger outcomes, and they'll lead to having conversations, developing collaborations, and potentially carving out niches and making new spaces, hopefully at at micro research and practice level, but also at wider policy level too.